So excited for our keynote conversation this morning, and I will not belabor the point. My friend and colleague Tansy McNulty, Melissa McKee, and Tawn Hill are going to talk to us about what we owe each other in crisis.
Good morning. How are y'all? Good morning. Good morning. So I'm from Mississippi, so that's not like rhetorical. When we say good morning, it's good morning. Hey, y'all, hey. So I am Tansy McNulty, and before we get started, I want to make sure that you have seen the room. And by seeing the room, I want to make sure that you actually looked around, past your table, past your row, to see who's here. Find some faces you do not know, smile, say good morning. I'm glad you're here. What's powerful to me about this is, like Tahir said, a couple years ago, we knew most of the people in this room, and now there are a lot of new faces. And I want you to take a moment, make this convening your convening, to meet 2 or 3 people that you don't know and genuinely connect with them. Sharing LinkedIn, that's great too, but getting their email, how can I work with you? What's your program doing? Learn that. Okay? Again, before we get started, let's breathe a little bit. I know it's real woo-woo. Just take a few deep belly breaths to bring yourself into the room. Remember, I know your phones are by you. Keep them there. You'll need them in a moment. But your phones are there. But take these next 25 minutes, we're up here, a couple minutes to talk with you, to just be present. So some deep breaths, cleansing breaths, and we're glad that you're here. Good morning. Good morning. Okay, again, I am Tansy McNulty. I'm the founder, CEO of 1 Million Madly Motivated Moms. It's a mouthful, I know. We go by 1M4 for short. Our mission is to end police violence in this country by the year 2038. And what I'm here to do today, and guess who's gonna help us? Y'all, yeah. So what I'm here to do today is to talk with my friends, Melissa and Tawn, and to invite you into the conversation. We're calling this like a fireside chat, but it's really more like a kitchen table talk, right? Where we invite you into the conversation, just me and my girls. So how we ended up in this space, or how I ended up in this space, was because we have a mission, right? To end police violence by the year 2038. Very clear, I'm in this work for 12 more years and I'm out, I'm retiring. But when I got into the work, I had to understand, like, what's the issue? What's happening? And so I spent a whole year and a half figuring that out. But the important part of that is we developed one of the first directories called The Right Response. You can type The Right Response into any search platform that you choose, and it'll pull up a directory of alternative response teams across the country. We put that out a couple years ago, 5 years ago actually. But the summer of 2024 is when I had to use my own resource multiple times. I had to call crisis responders, I had to call your colleagues 4 different times for 3 different family members. And what does that tell you? That tells you I called on someone twice because things got to the point where we couldn't control it or couldn't help them in the way they needed help. And that was tough, right? So that's why I'm here. So you see in front of you 3 women, 3 moms, and there's my paper, which is fine. 3 women, 3 moms who made active decisions and continue to make decisions to change, to create the future that we desire. Every day we make an active choice to create the future we desire. So me, as a leader of a nonprofit, as a mom who's raising 2 black boys, married to a black man, several family members with SMI, having the right person to call matters. And that's why I'm sitting right now in the center of this. So great to meet you all, and I want Tawn and Melissa to tell you why we're here, or tell you why they're here, and introduce themselves.
Hello, everybody. It is amazing to be in this room with so many advocates that are doing work. When I needed help, we needed help for our family. My son, Miles Hall, was killed, 23 years old, 2019, in a mental health crisis. He had schizophrenia. And there were no responses for us. We had worked and tried to make sure that police knew who Miles was. Years in the making, the final day when we actually need help, call the day before. There's only 2 mobile crisis units in the whole county of Contra Costa County. I live in Walnut Creek, California. Only 2 mobile response units in the county, and it's Monday through Friday. I'm sorry that there's no one here to help you. That was the moment, that was the defining moment that we could have gotten Miles help, and it wasn't there. So the reason that I'm here now is because my son, who was not a criminal, when we rely on law enforcement, there are deadly consequences. And the consequences is that my beautiful son was killed 7 years ago. We just made our 7-year anniversary 2 days ago. So this work is real. The reason you guys are doing this work is to make sure that this doesn't happen to somebody else. So we've created I have a nonprofit called the Miles Hall Foundation. We're a 501c3, and our work is to educate communities about mental illness, to protect those most impacted by excessive use of force by law enforcement. And that's exactly what you guys are doing and why the work is so important. So just grounding you guys right there.
Melissa?
Yeah. Hi, good morning, everyone. It's such an honor to be here amongst and with all of you. My name is Melissa McKee. I currently serve in the Olympia City Council office. However, I came into this work in 2018 after an 11-year stint in the Washington State carceral system. I happened to land in Olympia just as Ann Larson was building out alternative response or community response in our community. And I got to be part of that. And I got to see that there was this other way we could be doing things. And since then, I have worked in this field as a technical service provider, doing policy work with many of the programs that are represented here. And now I'm back at Olympia, making sure that the elected officials in my community have the information that they need to continue to sustain the program that we have there. And I, again, grateful to be here with all of you, and especially with the 2 of you.
Thank you, thank you, thank you. What do you wish, and I'll answer after you 2 would, like, what do you wish the systems, the prior systems, understood about your loved one or yourself in crisis?
I've thought about this question a lot, and what I keep coming back to, and we heard Tahir touch on this a little bit, is that there are many pathways to the moment of crisis. And because of that, I wish that the system understood that there should be equally as many pathways out of that moment. Unfortunately for me, in the early 2000s or the aughts, the late aughts, I think we say, those systems didn't exist. There was one way of doing things, and that was to try to punish behaviors out of folks, not accounting for the elements that were bringing me into those moments. For me, my story includes really intense addiction that started at a very young age, along with intimate partner violence that didn't get accounted for as there was this moment of contact with our policing system. And so that's the part I want to key in on as we're thinking about how to connect these systems of care, and who's at the table and why.
And what about you, Tan? What do you wish the systems understood about mine?
Yeah, I mean, that they're just so broken, right? Why are we looking to go to law enforcement when someone needs a 5150? If someone needs a 5150, my son was showing signs of psychosis for weeks. And, I had tried to talk to I tried to get him help like a year before, and there was just so many moments that were missed, right? So many gaps. So I really wish that the system, we're not relying on law enforcement. That's why we're all here, right? We're not relying on law enforcement as the way to get help, but we are making sure that people who are in crisis, as Tahir mentioned, have the right care. And so the systems, weren't set up for us. And I did everything. Like I went to NAMI, took all the classes, saw the things, saw him deteriorating in front of my eyes, and there's literally no way to get help. Oh, no, he doesn't meet this criteria. He doesn't meet this criteria. Oh, no, he's not a Medi-Cal. No, we can't do anything for you. Oh, no, he's 18. Sorry, there's nothing we can do, right? So there's all these things that are happening in front of you, and you see it happening, and you're like, no, 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 like, there's nothing I can do. There's nothing we can do. But there is something we can do, right? And that's why you guys are all here today. And I want to say, too, part of the systems now that we have, I may be skipping over to the next question, but, is that when we work together and we collaborate, right, we can change the systems, right? So, but I'm gonna stop there on that. But I think what systems we can have is systems that are compassionate, that don't come with guns. I always say, if you don't come with guns, and your chances of survival are so much higher. So that's why the non-police response program, and that's what our nonprofit we advocate for, is making sure police aren't the first responders to mental health calls. We've created legislation in California. We have AB 988. Does anyone know who that is? AB 988? So it is called the Miles Hall Lifeline and Suicide Prevention Act. So it is named after Miles. And then in our own county, we also have one of those mandated mobile crisis units that we needed, what we called for, and that was not there. Now in our county we have, and it's called A3. It's someone to call, somewhere to go, someone to come, and that's also. If you call, they'll answer, the Miles Hall Crisis Hub, right? So when we work together, systems can change because of the work that we all are doing. So just saying that.
Literally, like the system is in the room. Like you all, the choices that you're making every single day. I'll get some of this later, but the choices you're making every single day matter. And you were talking about like no wrong door, essentially getting in and out of the system as needed. What were some of the things that you've learned about what communities actually need?
Communities need care. There were a few moments of attempted interventions in my life, but what that looked like at the time was a clinical response, or somebody with a clipboard that showed up and again was making sure that I met the criteria, and there was nothing in that for me that I could grip onto. So communities need care. They need people who have walked these paths. If we're going to act as guides for communities in crisis or for people in crisis, then I want to walk alongside somebody who's done it before. And so, the exclusion of lived experience as we're building these systems at all levels. We talk a lot about peer work, but we need to have people with lived experience designing systems and building policies and doing that work alongside folks so that we can identify those gaps in advance. And I think that at the time was something that was absolutely unheard of. When I started working in Olympia, it was a heavy push to get me hired because of my criminal lived experience. It didn't take into account any of those elements that brought me into that place, nor did it take into account, except for by the advocacy of Ann Larson, again, I'm gonna say her name, how much I could bring into that space just by virtue of having suffered through. So that is a piece that I really want folks to walk away with. If we're doing this work without including lived experience at every level of it, we're doing it wrong.
So you mentioned, care. We need care, right? So Tana, what does care look like for us? For Miles, what did care look like? Or what could it have looked like? What do you want it to look like now?
Yeah, I mean, I think care for us was having someone who understood Miles, who could come and talk to Miles Miles had schizophrenia, so he had agnososia. So it's very, very challenging to speak to someone in a schizophrenic, episode. But yeah. Well, I think, if someone's in a schizophrenic with Miles, he had delusions and hallucinations, and he was knocking on doors in our neighborhood. And, so we needed stabilization. We needed him to get stable. And that's what we were trying to do. That's why we had tried to make sure law enforcement knew who Miles was. And they did. When they came, they knew who he was. And they still came, and they came with guns and killed him. So, care needs to be, for us, it just needed someone to help us. We were so desperate, and it's still, even though we have these legislations and laws passed, there's still so many gaps that we need to fill. And I think, as Melissa mentioned, having people with lived experience, is so important.
It is.
Yeah.
So care for me, the summer of 24, when I had to call, I told you multiple times, on a few different family members. And I called, so obviously, Black woman, Black people who we're talking about. So when I called on this family member, I had to pause for a second before that. Making that phone call was my last resort. It was only because I couldn't get someone else there. So always remember too, like someone came to you because they had to, especially when systems have harmed us in the past, particularly our community in the past. That was my last, I had no one else to call. But when I mention what care looks and sounds like to me, it's when I called this crisis worker, and her name was Miss Iris, and I will never forget Miss Iris, how kind she was. And I had to call on this family member because this family member said to me, well, I said, well, I love you so-and-so. You love me right now, but you won't love me when you see what I do. And that feeling when everything drops and you're like, oh, this is not good, because I knew what was in the house. We have weapons in this particular household. I knew what was in the house. And I knew hearing that family member say, you won't love me when you see what I do, when you read about it, when you see it in the news, I had to call somebody. And Miss Iris picked the phone up, and she's like, hey, this is Mississippi, the state's Mississippi, so everybody's country. Hey, how you doing, And I was like, this is what's going on at this family member's house. I really need you to get over there. This is what I do. And this is at a time, sorry, y'all, I'm dropping everything. Forgive me. I am so sorry. But it's at a time where I'm supposed to be this mental health advocate. Tansy knows. So, you're on television, you're this. And I had to call Miss Iris to get to one of my deepest people, the person I love almost more than anybody in this world. And she was so kind and so gentle. And I had to actually kind of deceive this family member by calling through my phone. I had to three-way in Miss Iris, because this person wouldn't answer the phone if they didn't know the phone number. And so when they answered the phone, and I introduced them to Miss Iris, and I could just tell after, it took about 15, 20 minutes over the phone before they came back to themselves. And I was like, oh my God. First I was getting mad at Miss Iris. I'm not gonna be mad. I'm not gonna lie to you. The first 5 minutes I was like, Miss Iris, I can do this. Like, what I need you gotta do something else, sis. Like something else has to happen. But then after about 15, 20 minutes, I started to hear my loved one again in her voice. I was like, oh, she's coming back around. And so for me, that care felt and sounded like home, because I did not know Miss Iris, still to this day don't know, wouldn't know her from Adam if I saw her, but I bet if I heard her voice, I would. Because in that moment, I needed her because I had no one else to go, and she helped my family members. So that care felt like someone hearing me, and it felt like home. And so moving a little forward, and we have a few more minutes left. So so for me, that family member, I couldn't get to them, right? I was hundreds of miles away. They needed something right then. They were saying something that I wasn't comfortable with my other loved one in the house. So what do we owe each other? Because it's some personal responsibility. We have systems change, right? But what do we owe each other? In this room, particularly in the fields that you're in, but also in our own households. Like, what do we owe each other in crisis? Literally the name of the panel. Like, what do we owe each other in crisis? When it comes to doing things that may be painful in the moment, like, what do we owe each other here and more, collectively?
We owe each other safe passage. And in order to have that safe passage, we owe each other hope, and we owe each other love, and we need to actualize and operationalize that. So much of what you all do every day, I know, is born out of love, and it could not be done without hope. And so what we owe each other is an opportunity to walk through to the other side. And that's what you do. You give folks that opportunity, and we need to continue to do that. And we need to push further and harder to make sure that everybody has access.
What about you, Tom? What do we owe each other?
Yeah, I mean, the work that you guys do is so, I'm sure, just is difficult, right? But I would say that you guys, what you owe the community, right, is to make sure that you guys understand, obviously people with mental illness, right? But you also take care of yourselves as people. I say self-care is very important in this work. I know for myself, being an advocate of my son who was killed by the police in a mental health emergency, self-care is really important. So I think what we owe each other is taking care of yourself, putting your mask on first, right, to make sure that we can help others, because the work you do is critical, it's life-saving, and it's so important. So, thank you.
Yeah, I would just add to that, we owe each other, particularly in this room, and as we're spreading the message of, community crisis response, alternative response, whichever name we're going for, we owe each other radical honesty for when things work well, and then when we have areas of improvement, because there's some areas of improvement for us in this room too. So I would say we definitely owe each other radical, transparent honesty at all levels. So as we're moving forward some, don't want to go there. So what do you hope and wish that this room would carry forward through this convening and as we move out the door back into our own programs and communities?
It's the same thing that I hope that we offer to the person in crisis, and that's awareness that you're not alone. You're not doing this alone. You have one another, you have us, and we can do so much more when we do it together. And so carry that with you. Don't forget when you get back to your desk or to your unit or to your field, or you have folks. And whatever you're up against, there's a pretty good chance somebody else in this room has been up against it too. So lean into that. Take care of yourselves and take care of one another.
What do you hope for us to carry forward through the convening and then afterwards?
Yeah, I think it's important to, center families like ours, right? Like things that, like our family, because Miles is not the only one. There's people being killed by police at, an astronomical moments, right? It's happening so often. So I would say I just want you guys to carry that, the work that you do is life-saving, that we need you, and it's critical that what you guys are doing. So I would say that, and also going back to communities, I would always go back to communities of color, right? And because people of color are being killed at even higher rates. So really understanding, making sure that you guys are, centering yourself in that as well. And it's nice to see that we have such a big, diverse group of people here. It's amazing. So I just want to give you guys all a round of applause for just being here today, spending your time here. I'm so excited to be here. Like, I'm just so glad to be part of this panel. So thank you.
Yeah, I know Melissa wants to add something.
Yeah, the other thing that I want to leave you with is that the impossible is possible, and the hopeless can become the hopeful. I was once a person that nobody believed would make it through to the other side. And I watch that happen in our communities every single day, where people lose hope and lose sight and believe that a person is lost. I was lost. There is a way through, and it's because of folks like you that I found my way. So I just want to make sure that we have that in our hearts as well as we go forward.
I love that. Also, as we move forward, I get to put my paper down now and click through. So as we're moving forward, I want to make sure we highlight Miles Hall. So this is Miles Hall Foundation. Ton is his mom. This is the work that they do, pushing forward AB 988. Additionally, getting the mobile crisis units there in A3, somewhere to go, someone to call, somewhere to go, and what was the other one? Someone to come. Yeah, so support their work, and by support, please donate to them. They have a QR code there. You can find them pretty easily, the Miles Hall Foundation. And then 1M4, my organization, remember I told you I only have 12 years left in this work. I have every intention of doing exactly what I say we're gonna do, no questions. So our next step in this as we move forward is we're developing a scripted television series. Our first name was The Right Response, and our writer said, no, it's not gonna be. So the current name of the scripted series is Crisis Response. That QR code there will send you to our support page. So what is a support page? It's literally saying that I want to see alternative response scripted series on television. And it gives us permission to call you and ask you questions about, is this script going in the right way? Should we go this route with this character development? And the reason this is important moving forward is a lot of people understand what policing and fire and these other types of response do by what they've watched on television. They're not doing ride-alongs. They're not doing their ride-alongs. They're watching television saying, oh, that's what this looks like? That's what this work looks like? So we're trying to, and it's not really a narrative change project. It's more like narrative establishment. Like, this is what this is. This is no longer a pilot. These will be permanent programs across the country. This is what this work is. Some of you, probably about 20 of you in here, got a survey from us a couple months ago asking you to share your stories about the most memorable response that you've done. We've taken those stories. We have developed the characters behind them. We have stories that will follow the script. And the reason we're doing this as a scripted series and not a documentary is because we want to be able to tell the humanity of the people who are being responded to, our community members, in addition to you all. So there are characters who are responders, there's peers, we have the city administrator that's on the show as well, to show how answering the call to someone in their heaviest moment can impact their lives when they go back home at the end of the day. So right now, you'll see in the support page, you'll see, hey, do you support this type of project? You'll see our one-pager. When you click on that link, the one-pager will spill out for you. It's a scripted series that's set in Las Vegas, because 1M4 is a Las Vegas-based organization. We have national coverage, but we're Las Vegas-based. And we're gonna show what it looks like on the Strip, like what the Strip can look like when you're protecting tourism dollars versus what people who actually live in Las Vegas, like I did for so many years, what type of response they get. We're diving into the unhoused community. We're going into everything that you're seeing. It's not just, mental health will be a key component of the work, behavioral health, unhoused, substance use. We're going there. And so we need you to go there with us. So that QR code is to our support page. Find me in any of the hallways. I would love to tell you all about the show and how I'm gonna use this show to push us forward in this work and make it truly permanent across the country. We're taking viewers and changing the viewers from just being a show that you watch to being a show and an experience that you advocate for. It's gonna have you asking, like, now why don't I have an alternative response in wherever, Idaho or Nebraska, wherever you may live? So viewers will become advocates without having to be told that. Does that make sense? So please join us in this. If you know any producers, production companies, networks, actors, directors who want to attach themselves to the project, I learned that, y'all. So when you develop a television series, you want to attach people to it to get you in the door to Netflix, to your ABC, your CBSs. So please help us get attached to some folks, and then also be willing to come talk to us so we can bring your stories to the small screen. So as we're watching, so that's what we're carrying forward. So everyone come holler at me about the show so we can make it be, so this time next year when we're at our convening, we're here, so I can hold them to it. So next year's convening will be, premiering, hopefully, something for you to see to be on your screens in the fall. So lastly, what are we not caring for, it's not the right one, I'm sorry, y'all. Oh, yeah, what do you hope what do you hope or what are you going to actively do for this convening to be the best use of your time? And what are you hoping for the other people who are here? That's for both of you.
I hope the same thing for me, for us, and that's just that connecting, strengthening through it, and being inspired, and sharing yourself with one another, as I will share myself with y'all.
What about you, Tom?
Yeah, I would say, the reason we've been so successful, like in our own communities, is because we coalition build, right? We worked with other organizations to call city councils, go to the state to demand legislation changes. So we're powerful, right? We're powerful when we mobilize, when we get together, and I feel like that is a superpower, right? Of so many people in this room, and don't forget that you can literally move mountains, right? You can move mountains because we come together. So I think I'm excited because I'm gonna come to a lot of you. I'm gonna be talking to you because I'm not shy, and it truly is about networking. So I'm definitely looking forward to meeting some of you. Please come talk to me. I'm gonna come talk to you if you don't, but looking forward to spending time with you guys for the next couple of days. Thanks.
So we appreciate your time. I was on the flight over here. You know how on your flight they show you how to put the seatbelt on. And I was thinking, like, why are we still doing this? Like, everyone knows how to put a seatbelt on. However, don't ever assume that, because there's someone who hasn't flown. Never assume that everyone knows everything. So even in this room where everyone knows some form of response, people don't know what you do. So tell them. As you're meeting them over lunch, as we're between sessions, as we're in the nursing room or doing our activity from Dr. Chris, tell people what you do. Ask them what their challenges are. Really connect in a meaningful way. And I think you'll make this convening the best one yet. Have a great one, y'all.